Thank you for joining us today. So, today we're going to be talking about social vitality and how our social vitality goes along with our mental and emotional health and our overall well being. So, when we're talking about social vitality, we're talking about our support systems, those friends and family members that we have in our corner, in our inner circle, and how they may bring joy and comfort into our lives. So we're at a point now. It's been over a year since we dealt with the COVID-19 pandemic. So now we're at a point where everyone is, we're doing our mental check-ins. Everyone is checking in, or we're finding out things about ourselves mentally and just overall that maybe came out during this pandemic. So now we're at a point where we're opening things back up. We're doing things in a safer manner to where we are able to interact with others, which is helping, in a number of ways. So when we're talking about that social vitality and the supports that we receive from our inner circles, we're also looking at the energies that are brought into that and how it could affect our mental and emotional beings. So, in saying all that, we want to make sure that when we're checking on our um, mental and emotional beings, we're checking not only on ourselves but those in our circle. How are they affecting us, balancing things out for us, the energies that come in with those supports. So we want to make sure that our support systems are truly that supportive, making sure that the people we have that we are closest to, those we are trusting in our group, making sure that they are okay, making sure that they are okay for us. And what I mean by that is making sure that whoever we have in our circles who are contributing to our social vitality and our mental and emotional health, making sure those people are stable, making sure that they're ones who we can really count on. They're not there to bring us down. They're going to be there to support us and to contribute to relationships that we have. We want to make sure that when we're talking about social vitality, emotional, mental health, we're able to display healthy relationships, healthy connections with others, so that we're able to teach our children how to do the same. When we're talking about our vitality, we have to nurture ourselves, but we also want to make sure that if we're having friendships and relationships, we're able to give something positive to those. We're able to nurture the friendships and relationships as well. So, during this time, people have had time to work on themselves. We may say improve on some things. If it's our mental health, we've had times since this past year that we were in our homes a lot more. So, we might have found things to do around our home. Projects that we worked on that we hadn't been able to do. We also had time to work on our physical and emotional health, also our financial health. But we've had time to reevaluate where we are, reevaluate some friendships, some connections that we have, relationships. So we want to make sure that when we're working on improvements to our overall vitality, that we're looking for the positives. Are those relationships or friendships, are they nurturing to us? Are they bringing positive energy to us? Are they bringing things into our circle that's going to elevate us, that's going to help? Or, enhance those relationships? Or, is there more negative things? Maybe people in your circle who are not as supportive as you thought they were. Or maybe you've been that friend that hasn't been as supportive, or in the partner in a relationship that hasn't been as supportive. So we have to make sure that we're evaluating ourselves, making sure that we're finding time to do a quick check-in on ourselves, and then talking about how we can do this, adding things in that may improve our relationships, whether it be a phone call, whether it be us helping a neighbor, just finding things that, will help our vitality. It's not always, people pouring into us. We can improve our vitality by also contributing and helping others. So, we want to look at, who are we spending our time with? How are we spending our time? And then with the time, are we balancing things out? If you feel or you find that I need more time to meditate in the mornings, you have to rearrange your schedule to do that. Or I need more time to cook healthier foods. You have to plan, you have to prep. There are even options where you can order prep meals for you, but finding the time to do that. And then, so when we're looking at, how within this year we've changed or improved our vitality, when we're looking at especially our social vitality, this time has really offered us more time to use electronics more, technology more, to reach out. So this has been a way for us to reach out to those who maybe we aren't able to connect to as often as we'd like, whether it be due to distance or schedules with work, things of that nature. So, how has technology helped you during this time with your social vitality? Or do you think, sometimes you can just kind of evaluate and say, how did technology hinder my social vitality? Maybe you just stayed home, you isolated from others, and you didn't reach out to anyone, whether it be by phone, social media, or any of the apps, such as Zoom, that would allow you to have that interaction without being right there face to face. But technology, can help also going forward post this COVID-19 pandemic in ways such as, still finding that time to connect or link with those family members or friends who may live a great distance from you, and you may only be able to visit in person, a couple times a year. So you can still rely on technology to assist you with improving your vitality and your interaction with others in a safe manner. Or also reconnecting during this time with, in ways to help your social vitality improve. Maybe you had ran into a friend on social media that you hadn't had contact with in years. Maybe you just had busy schedules, relocated, lost touch, whatever the reason was. But technology allowed you to reconnect or rekindle relationships. Some people may have been distance due to maybe their work environment, or maybe they had health issues, so they weren't able to be as in close contact with their close family and friends, or their spouses or partners. So technology would help with those relationships as well. So just during this time, it's important to remember that when we're dealing with improvements or changes to our social vitality, that we're focusing on improvements, and how can we do that? One of the ways, you think about, sometimes we just need to take those mental breaks and just evaluate ourselves. Think about what can I do to improve this? The weather is warming up now. We're in the spring season, so we're having warmer weather. There are mandates being stopped, or they're ending mandates, lifting mandates that were put in place months ago. So we're trying to safely do things that will bring people together, and that will increase a lot of the social interaction with others. So just being in contact, having human contact, that will help, with our mental and emotional beings. So we have to remember that, we can do this in a safe manner, but, don't do anything that would decrease or take away from the improvements you've already made with your mental and emotional health. So if you're at that point where you don't feel, safe going out or doing things right now, keep that in mind. Continue to use that social media, technology, and things like that to maintain connections. But as a human, we want that connection. We want to feel like we belong to a group, to have some type of connection. So the human side of us has somewhat suffered, for many of us, not being able to hug our loved ones, not being able to see them face to face. Sometimes you may feel a phone call is just not the same. Not being able to go to your little league games as you would normally do without restrictions. For our children, not being able to play, go out to some events in some venues due to restrictions that were put in place. So we have to consider all of these changes that we have gone through within the past year, and just kind of take a look now as to where we are, and go back and maybe you journal or keep notes of things, and just look back to where your mental health was several months ago, compared to where you are now. And we can do a comparison and a contrast. What did you learn about yourself during this time? What do you plan to improve on? What do you plan to change? Are you going to continue to use social media to maintain some of your social connections? Are you just looking forward to being able to be back in person with those that you love? And just work on, we can use this time to work on some things, again, within ourselves, so that maybe you were more of an introvert prior to being home more, and now you're looking forward to going out being more extroverted. But again, just process it on in individual basis. Don't do things that you don't feel comfortable with. But when we're talking about improving our social vitality, to work towards our mental and emotional health, again, most people during this time, they really didn't like being away from others, having that interaction, that human interaction. So this is a time for us to just kind of, work on those social skills, work on, how we feel about ourselves mentally. Are we able to process if there are going to be changes coming forward? These are things to think about. And so when we're talking about, how things are changing for us, think about this. What is going to be your new norm going forward, and how will that affect your mental and emotional health as well as your social vitality? If there are restrictions that remain in place, how do you plan to go around those things to still interact with others or socialize? How has that affected you? These are things to think about. How has that affected you? How have the changes affected you? What do you look forward to changing? Or what do you want to keep? Some things that came about during the pandemic, maybe they kind of slowed us down a little, gave us more family time, more time to think, try new projects, just find new hobbies. Are those some of the things that you're going to continue to use going forward once things are returned to normalcy? And so, just thinking about, again, how is your mental and emotional health right now being affected by your social skills, your social interaction, your vitality with others? What do you look forward to most? What are you going to leave in this COVID-19 era that you don't want to take forward? But this is a good time for us to just kind of evaluate ourselves. And if there are children in your home, children that you're in care of, this is also a good time to talk to them, because these children have also had to make changes and adjustments. Play dates aren't the same or haven't been the same. Activities haven't been the same. School definitely has not been the same. There had to be changes made. If you have older children, teenagers, some of their activities were limited. Young adults who are away at college, they definitely had a different learning experience this past year. So, it's good to check in on our youth and our children as well, and just making sure that as parents and caregivers, we're able to model the healthy habits that we want them to pick up as far as their mental and emotional health. And one of the ways to do that is, again, to check on our own social vitality. What is it that we're lacking? What is it that we're improving? How are we going to improve that? And how those improvements or changes going to affect our families? So, these are just some things to think about. Evaluating our relationships. Sometimes friendships end when you really sit down and think things through. Again, going back to what I said earlier with our support systems, and how our support systems are there to support us and bring change or improvement, enhance those relationships that we have, not to bring you down or tear things down. So sometimes if those relationships aren't healthy, those friendships aren't healthy, then this is definitely something that could affect your social vitality, and in turn will have a negative effect on your mental and emotional health. So sometimes evaluating those friendships and relationships we have going forward will help. It takes stress and a load off of us so that we're not carrying things around that aren't needed, that will, affect our mental and emotional health in a negative turn. If you're stressed, if you're dealing with things that you shouldn't be dealing with, that takes that time. Going back again to when we talked about balancing time, that takes time away from things that you could be, doing with your family, things that you could be working on to improve yourself. So we definitely want to leave all the negative things in the past, and move forward with positive activities, positive things that we can do that will uplift us and uplift those in our families and our inner circle. So just taking the time to reflect on where you were, when all of this started happening, and where you are now. And also, have a plan of where you would like to go. What changes are you looking forward to making? What improvements are needed to be made? And just take simple steps, small, simple steps. Start one step at a time and just implement whatever plan or whatever changes you want to have in place to improve your social vitality. Start small. Don't go into it thinking you have to get everything done right then, because most times that ends in not completing or not getting the results that you would like. So if you're looking to maybe going out, enjoying a nice family outing, a safe family outing, take the steps to plan. Make sure everyone in your family feels comfortable. Make sure you feel comfortable, and just plan, make those steps. Maybe you're looking forward to, you started a hobby during this past year, and you're looking forward to joining a local group who also has interest in this hobby. Just small steps. And then that will, help build your circle, your support, which helps with your social vitality. And again, ends up helping your overall mental and emotional being. So just take the time to plan, take small steps, do what you feel comfortable with. But again, you can always evaluate on an ongoing basis of, where you were in a year from now, where you are today, and then where do you want to be? Where do you plan to be? So taking those small steps to focus on getting to where you would like to be mentally and emotionally. And don't leave your children out in the meantime. Again, check on your children, check on those who you're closest to, because everyone has had some impact, been impacted in some type of way from this, some effect. So make sure that we are checking on our children. The school year is coming to an end for those who are still in school. Some of the young adults who are in college have already ended their courses, and maybe you had some who were graduates. This has affected them all within the past year. So be mindful of that and check in with them emotionally, on how they're doing, making sure that they're still, having goals and plans to move forward, and being there, being a support for them as well. So again, just make sure that we're taking time to evaluate our where we feel we are with our vitality, and take the steps needed to make improvements or changes that will get us to where we would like to be in the future. So this month is Mental Health Awareness Month. So just take time to just do a quick assessment on yourself. Find out where you are, where you would like to be, what changes you need. Seek help if you need it, and check in on those around you just to see if there's something you can do to reach out and offer help. Even if it's just helping them find a number to seek professional help, or being there and providing a listening ear. But taking the time to take the steps needed to get you where you would like to be overall. And so thank you for joining today, and we look forward to talking to you on the next time.